Welcome to Resilient Rehab and Performance's 4-Minute PT. Today I'm going to help you understand and apply some diagnostics and treatment ideas to address front of the shoulder pain. So in addressing front of the shoulder pain with an athlete, you want to see what category of issue you're falling into. You also want to maximize their participation in whatever sport they're in by modifying what they're doing, how hard they're doing it, to help them train with maybe improved technique, but still be participating and active. And then finally, you want to get your tolerance to load and compression through that shoulder back to where it needs to be. And isometrics and eccentrics are a great way to start with that. I think it can be helpful to group shoulder pain into 3 main categories when we're assessing and treating it. So first we have the loose shoulder, where things are moving too much. Then we have the stiff shoulder, where your range of motion is pretty severely compromised. And then finally we have the weak shoulder, where the connective tissues, tendons, and muscles are not up to the job that we're asking of them. So going back to our case study, our lady is a climber, primarily has the sharp pain, can get pretty intense when she's climbing more overhung routes, doing pull-ups, or when she's laying on that left side. So in the clinic, we'd first want to rule out and screen for any non-shoulder problems that might be referring pain into the shoulder. We also want to take a look at her climbing technique and make sure she's climbing in a way that's healthy and utilizing her shoulder most effectively. And then we want to make sure her range of motion and strength are where they need to be to do what she's asking of her shoulder climbing wise. So in her case, there's no neck problems, no upper back problems, and no nerve related symptoms coming into that shoulder. She has most of that pain localized to here. When we check her range of motion, to the front is pretty good, no real pain there. Doing thumbs down, it's a little tighter, gets to about here. Going out to the side, she is more limited, getting to about here with thumbs up, and then a little bit lower in the thumbs down position. Rotation at her side, as well as up at 90 degrees, is pretty much pain-free, although it's a little sore at the very end with external rotation. Strength-wise, through the left shoulder, her external rotation is definitely more painful than the internal rotation, pressing towards the stomach. And the external rotation is more painful up at 90 degrees, pressing back in this direction, than down at her side. Resisted flexion is pain-free, and abduction is mildly painful. Looking at her upper back range of motion, that's also a little limited. We'd also do a few tests to rule out shoulder instability and any sort of labral tears. In her case, all of these were negative. We also do a little test for impingement here just to see how we're doing. That is the only one that's a little sore. So in this case, she doesn't have a significant range of motion or stability issue through that left shoulder. Her issue is that the connective tissues in the front and outside portion of the left shoulder are not up to the job that she's asking of them while she's climbing. A lot of times this would be diagnosed as an impingement syndrome because the battery of tests that we did fit the impingement syndrome diagnosis, although this can be a little bit of a misnomer because it is totally normal to have the front of the shoulder tissues impinge or stop at some point in your range of motion. Your arm's not a windmill and be able to go round and round. So when it comes to treating her, the first thing we need to look at is her climbing technique. In this case, she tends to climb with her upper back and shoulder blade muscles fairly relaxed. That can be a good thing to save energy, but it does place a little bit more strain on the front of the shoulder. So cueing to climb with tight upper back, pinching your shoulder blades together a little bit more is a nice way to decrease how much tension she has on that front shoulder. I'd recommend climbing overhung routes that typically cause her problems at several grades easier, where she's not having a lot of pain and she's able to focus on good scapular or shoulder blade retraction and tension. So while we're maximizing the climbing that she's able to do, we also want to decrease that pain. So isometrics and eccentric or lengthening motions of the shoulder are good ways to start to build tolerance to load and tension through the shoulder. So bicep isometric, a shoulder external rotation isometric, and abduction isometric are all great ways to start with this. Doing an eccentric or reverse lat pull down is a great way to get more overhead range of motion without irritating the shoulder quite as much. And then progressing these exercises onto heavy bicep curls, external rotation, eccentrics are all great ways to start to build strength through that shoulder. And then finally, we need to address that upper back stiffness. If her shoulder blade isn't able to get into an efficient position to support the shoulder joint ends up having to do a bit more work. That can irritate it. So doing some rotation stretching, some cat-cow, those are all great stretches to start to build some mobility through the upper back, and then doing bent over rows and shrugs to help strengthen those shoulder blade muscles would be a good step to reinforce those new movement patterns. So in addressing front of the shoulder pain with an athlete, you want to see what category of issue you're falling into. You also want to maximize their participation in whatever sport they're in by modifying what they're doing, how hard they're doing it. And then finally, you want to get your tolerance to load and compression through that shoulder back to where it needs to be. And isometrics and eccentrics are a great way to start with that. In our next video, we'll dive into more climbing-specific strengthening and stability exercises that would be good for her in this. Reach out to me on resilientrp.com, where I offer telehealth PT services, or send me a message on Instagram or YouTube.